This podcast cannot and does not contain medical or health advice. The medical or health information is provided for general informational and educational purposes only and is not a substitute for professional advice. Accordingly, before taking any actions based upon such information, we encourage you to consult with the appropriate professionals. We do not provide any kind of medical or health advice. The use or reliance of any information contained on the podcast is solely at your own risk.
Living in the world with an whole soul. The rich men know the rich men, Lord knows they all just wanna have total control. Wanna know what you think.
All right, and welcome to, I know it's going to be confusing, but episode 7 of the Stuck Pig Academy of Medicine, even though it says chapter 9, because we've had some double chapters, or some episodes where we did 2 chapters. Let me
phrasing
correct that. So we are on chapter 9, instructions and precautions for injections.
As long as we're not chaptered out, we're good.
Yeah. This just general overview of this chapter. It's dated. You can tell this book was written in the 70s, but you'll see that as we kind of go through the review today.
Yeah, the antibiotics, they exist. But all right, I don't know if tetanus antitoxin is out of date necessarily, but most of these, like, I wouldn't, and epinephrine is for all time, so is Benadryl. But as far as the antibiotics, most of them are out of date. We can go through those. I'll mention some exceptions to that, but wouldn't hang my hat on the antibiotic recommendations in this chapter. But that's not the point. The point is to talk about their very most favorite subject, other than land reform, which is injections.
Yeah.
And how injections are all the things you have to be careful about with injections.
Yes. And I mean, to be fair, especially when this was written and where it's written for, you might not, they're probably not running around with this isn't Seattle. There's not exchange points to get new needles and new syringes. So like in the 70s, like where they were doing in austere stuff, like they're probably using a lot of the older style, like we talked about kind of in the pre-show. So if you want to get in on that, join on the Patreon. Shameless plug.
We had a lot of fun.
Yes.
We talked for like 45 minutes before we started recording.
The use of like the old like glass syringes and reusable metal needles that you would have to sterilize, after use before you got ready to use them again. Like the old movie, I know they reference it in Pulp Fiction, with like the black zipper pouch. Like always like, that guy does drugs because he's got a black zipper pouch, and it's like a syringe and a couple of needles, and then the baggie. So with that, I guess there's probably a concern of infections and some of the other things, and then like there's obviously like medication concerns, but those are I think grossly over represented here.
I think part of this goes back to the core of like people thinking that everything needs antibiotics, and I'll give you a more recent example. I was talking to a patient and her spouse about, basically she just had a big earwax impaction, so why she couldn't hear. And so I go through like all the different ways you can get earwax out of your ear and blah blah blah. And these folks were they were not born in the US. They were somewhere from Southeast Asia, and their question was, do they need antibiotics? And I just was sort of like, no, you don't know. You try not to just like stop and stare. But again, this is like, okay, this is, having read what we've been reading about, it's like, that's really interesting, because they've talked about how prone the target population for this book, which is mountain Mexicans, Mexican folks in the mountains, they tend to go to antibiotics for everything. I did not expect that question. for
Yeah.
when you have earwax in your ear. That's not an infection. It's okay.
No.
But anyway,
Yeah.
kind of
On
back to
the first bold little box, I think is always a very interesting start to each chapter. I always generally highlight or write something next to that. And on this one where it says it is more dangerous to inject medicine than it is to take it by mouth, I wrote source question mark as a true social media millennial that I am. Because I can think of a couple of situations where taking medications by mouth can be more dangerous than injections, like especially like talking about like the wrong medication. I know I'm being very like pedantic and
there
like
are some
splitting
medications.
hairs.
There are also some medications that are not available in an oral form.
Yep.
And let's see, there are some legit medications that really like some of the I believe some of the cholera medications are designed to be taken by mouth so that they work in the gut, because that's
thinking C. diff.
I'm thinking C. I thought cholera also, because cholera never really never entered the cholera bug stays in the gut. It secretes a toxin into the tissues.
Yeah.
So I thought that part of that was the oral antibiotics to target. I mean, certainly C. diff because it's in the gut. But as far as to the danger, I mean, to paraphrase Stephen He, you are a donut. Okay. You are basically muscle and bone wrapped around a gastrointestinal tube. I don't know what the reference to tube is, but anyway, Brandon Herrera says it, so I'll say it. Tube. And so yeah, okay, technically you are a donut, okay, because your gastrointestinal system is still technically external to your tissues, right? So it's still a barrier if you think about it. And when we take a needle and we put it through skin, we are crossing a barrier. We don't really think about that as far as like anything taken orally is still kind of being external to our tissues and our body. Because yes, it is in your body basically. But in another way, it's not. In some ways, yes. But
phrasing.
All right. So it is more dangerous to give than to receive. Okay. Or something like that. All right.
So cholera, yes, you do only treat it orally, but you shouldn't treat it.
So cholera, you can give those medications orally, but you just do supportive care. Yeah. Yeah.
Now that I know that this author is not like a doctor and he's like a public health guy, like this makes a lot more sense, like understanding like the author and all of that and his background, non-criminal background. Allegedly. But understanding that, like, it kind of like you can tell, like, even if this, like, say this guy was a doctor, like, he probably didn't spend a lot of time doing rotations in the ER because, like, I know from my background, like, there's lots of times where, like, for us, the preferred route of medication administration is injection or IV because it's faster.
It's faster, but you can give higher single doses, IM or IV, and so you can complete treatment course in a single dose, as opposed to saying, here, take this twice a day for 7 to 10 days.
Yep.
So
compliance is better.
Compliance is better, and or just easier. Like it depends.
Yeah.
So it doesn't necessarily have to be that they're going to be poorly compliant, but it's like intentionally they're just like, okay, what's the resources and the availability of this. Rent, here's your fun fact today for cholera. It's worse in people with type O blood.
Cholera is worse in people with type O blood?
Yep.
Fuck.
Huh. And medic's like, oh.
On the plus side, it takes a very high infective dose to become infected, and only 1 in 400 people who are even infected become symptomatic.
Okay.
However, once it becomes symptomatic, purely symptomatic.
So can you quantify cholera being worse in type O blood, or do they quantify it?
Higher mortality. It's 0.2% for the aggressive fluid rehydration, but
0.2% mortality for type O's.
In
with
general,
aggressive
across
breathing?
the board.
In general, that's your baseline number. Okay,
Across
0.2%.
the board with treatment.
With treatment, yep.
Meaning supportive care only, it's
Yep.
0.2% mortality.
Okay.
But I don't have the exact numbers in front of me, but from that description, that would be skewed toward the type O's.
I just wondered if for the blood type O's that they had a subset of data.
They're not very.
Okay. Because I always like to quantify like what do we mean when we say it's worse? It's like how much worse. And same thing is like I was doing a little bit of reading on using azithromycin for COPD patients, right? And as far as like improvement in outcomes, it's like, well, okay, in the study I think they looked at it was like 100,000 patients or so for a year, and it was reduction in mortality reduction in mortality. The control group was like 1.87 in 100,000 people as far as the deaths, versus with azithromycin it was 1.4 something. So it's a reduction. It's not a lot of reduction. So
here we go.
Yeah.
All right. From the NIH. Take that for what you wish, but it made it into a peer-reviewed PubMed article. All right. Many investigators have confirmed a strong link between cholera and human blood type group O. Although blood type O does not affect the risk of being infected, it has a tremendous impact on disease severity. In a controlled setting when cholera was purposefully introduced to Peru in 1991, good luck. Individuals with blood type O were 8 times more likely to be hospitalized. Did you say
cholera was purposefully introduced to Peru?
Yeah.
That sounds like a whole other story.
Yeah.
Okay. Continue, please.
Bill Gates. What?
Individuals in 1991, and when cholera was introduced to Peru, individuals with blood type O were 8 times more likely to be hospitalized with severe cholera.
Okay. 8 times. Okay.
Yeah.
Not 8 times infection risk, but 8 times morbidity.
Mortality.
Morbidity and mortality.
I'm
Okay.
looking for the mortality, but usually mortality follows morbidity.
Okay, and that's okay. Okay.
Cholera spreads to areas with higher prevalence of blood type O.
So my guess is that for whatever reason, I mean, the only things the things we know about type of folks with type, they don't have those antibodies, or they don't have the antigens. So maybe there's some antibodies that their bodies haven't produced. So if you have AB antibodies that you normally would produce.
All right. No, it's so there is a significantly greater cyclic AMP response to cholera toxin in enteroids derived from blood type O.
So, all right, can you run that by me? So cyclic AMP.
Sorry.
Yeah, so I remember cyclic AMP is like a messenger.
So basically, your signaling is upregulated in type O.
Okay, so if I'm understanding correctly, the signaling molecule CAMP, which I can't, man, that takes me back.
It's a broken down form of what your body uses for energy.
Right, ATP is what you burn for energy. AMP has only one phosphate phosphate group, so it's a derivative of it, but it's used as a intracellular messenger, intracellular messenger between cells, and so the type O blood type has a higher amount of that.
Has a higher affinity.
Has a higher affinity of that.
Toxin. And the toxin exerts a more potent effect.
So it takes those toxins into the body better.
Yep.
Because remember, the cholera bug is staying. The bug itself, the bacteria itself, is staying in the gut, and the pathophysiology relies on that toxin being secreted into the bloodstream or into the cells, into the body.
It has everything to do with how the toxin is taken up. It doesn't have anything to do with infection risk or the amount of toxin that even binds to the cells.
Huh. Interesting.
Yeah.
Okay.
So I have found out how cholera was introduced to Peru. They believe it was started when a Chinese freighter moored in Lima Harbor discharged contaminated bilge water containing a cholera strain found in Asia.
That would do it.
The Chinese would never be irresponsible with their biohazardous waste.
It's also Lima. It grows everything.
I was Googling cholera introduced to, and the second like auto search is UN introduced cholera to Haiti, which I feel like is also worth clicking on.
We're never gonna get to it.
Oh,
But
introduced after sewage leaked from a UN camp housing cholera infected peacekeepers.
yeah.
Oh, okay.
So
Hmm.
cholera has an affinity for salt water. It's stable in salt water, which is why it can persist in things like getting dumped to a harbor in the pond.
Wow.
Lasts for 6 weeks when there's organic matter in said salt water. Lasts
Wow.
for a few days when it's in fresh water.
Huh.
So
Dang.
the stuff is there.
So
Also,
stay away from the coast, kids.
Yeah, that too.
Stay away from the Chinese.
Well,
Aerosolized
I mean,
than fecal oral.
Say again.
Aerosolized is a lot more potent than fecal oral.
So that's interesting because it takes us back to that. It takes us back to Sharp. So when they're so like I was feeling all superior about like cholera is a bacterial drug or a gastrointestinal drug. It's like why like the whole like them covering their faces for a cholera outbreak. That's just they just didn't understand.
But the point is, it has to be aerosolized. It has to be purposefully aerosolized. If it's in a water supply, it's not aerosolized.
Unless it's in a sprinkler system or something. But yeah, gotcha. Okay,
Hmm.
okay. So they were right accidentally.
Yes.
There's probably some people at Fort Detrick that are trying to figure that have already, well, long since already figured out how to purposely aerosolize cholera.
Purposely by accident.
Yeah.
I'm sure that would never happen. Anyway,
that's good to know. That's handy information. That's really you can air. Wow. Okay, that changes some things.
I'm just turned off.
Stay away from Chinese lawn sprinklers. That's what I take away from that.
Stay away from anyone's lawn sprinklers.
All right.
Yeah, and we have this very odd list of the only times medicine should be injected, which we did talk about when it doesn't come in a form that can be taken by mouth. There are certain medications, non-parenteral medications.
Traxone is a great example, which they talk about later. Rocephin.
Yeah. So generally, a lot of the stuff that is made into injectable form is made that way because it can't handle going through your through your stomach and through your GI tract because of all the stuff that's in it would destroy the medication. So that's why it has to be that way. When the person vomits often, cannot swallow, or is unconscious.
That's
yeah,
but yeah,
pretty standard.
Down and again, I think we beat this with a hammer, but if someone's unconscious, don't put anything in their mouth.
They can't
unless it's an airway. don't do that.
Yeah.
Certain unusual emergencies and special cases, see the next page. So we got that list of those things.
Yeah.
All right, what to do when the doctor prescribes injections. So they rag on doctors and other health workers for a little bit. And so basically they're just saying like, yeah, doctors assume that people understand the basic precautions of giving infections and the technique of giving injections. Freudian.
No, that was 2020.
We assume you understand the precautions of giving infections.
Oh man.
This will be a little sticky dress and make that pull that off.
What? Say that one more time. A silky slinky dress and what?
And a beard.
And a beard.
Make it a Freudian slip.
Make a Freudian. Oh, a Freudian. I thought a slinky little slip was how you give infections. Okay.
Well, I mean,
there's that too.
There doesn't have to be a slinky dress. There's not a lot of people that wear dresses in Jacksonville, and there's a lot of stuff getting spread around Jacksonville.
Yeah.
So I think it's a good idea to just on this little this diatribe, because once again we have to get apparently into social issues to talk about health.
Well, we have to get into their choice of social issues.
Yeah, their choice.
My favorite social issue when it comes to health is
Land
Ready for this?
distribution.
All right. What?
Land distribution.
No, my favorite, legitimately, my favorite issue when it comes to healthcare is people in general and women especially need to carry a gun because being beaten,
Yeah.
raped, and murdered is bad for your health.
I can get behind that.
I don't have the studies to prove it, but I'm pretty sure
Wow.
I can go with my clinical judgment on that. All right,
All right.
that's my soapbox.
I think it's a fair thing that they're talking about, like just having a discussion with like your doctor or health worker or whatever title the person, because titles are a thing that people are really weird about right now. To
I
your
prefer baronet myself.
the person that gives you drugs. I think it's a fair thing to say, to like have a conversation with them if they're trying to give you like a medication. Like, hey, like, are we 100% sure that this is like the one have we gone over? What are all the side effects? Is there stuff that like potentially has other side or different side effects or would interact different ways with other stuff that I might be taking or other things like within my lifestyle, whatever that is? It's important to have conversations and not just assume that like the doctor has made the best decision. And not saying anything malicious about doctors, but like at the end of the day, they are human beings and they're capable of making mistakes. And also at the end of the day, like it is your body, like you are the person taking that medication. If you have questions or concerns, you should be bringing those up, and
Especially
getting your questions answered.
you want to make sure that if you have allergies to certain medications, if you have basically just want to make sure that like this provider has gotten a decent history on you, which I know we've talked about in the past. It's like, and this is more of this probably in the modern context, it's probably more of an issue for urgent care. As far as like you come in and you just like Joe Schmo off the street, like they don't know you, they don't know your history, like whatever they get from you is what they get from you in that time. So yeah, like allergies, past allergies is a huge one. If you have a tendency to a certain kind of infection, like what has worked before, what has not worked before, what has had side effects. Because not all side effects are allergies. Those are two different things. So just to expand on that a little bit, allergies are rashes, swelling, wheezing, and your airway closing or anaphylaxis. Can be shock, but which is where you cannot maintain your blood pressure because your arteries, which normally stay nice and tight and keep all the fluid in that should be in your blood, those they become very leaky, and the fluid that should part of your blood starts to seep out, and you can't maintain your into your other tissues. You can't maintain your pressure. That's what shock is essentially. So that versus side effects, right? Which side effects are legitimate too? Is like, oh, I was violently ill, or whatever with a side effect on this particular medication. Those are good things for them to know too. All right.
Yeah.
So emergencies for these sicknesses, and they talk about severe pneumonia. I'm not sure exactly how they're qualifying that, but okay. I would start with a pulse ox, honestly, just an oxygen level, and also function. Function is a good thing.
Yeah.
Gangrene, as opposed to the gang that's what is it? Is the Crips red or the Bloods are blue?
Bloods are red.
There we go. So that's
Crips are blue.
There we go. So those are the gang blue. There's gang red. Well, the gang green. It's not what you think. Or was that anyway? Infections after childbirth, ampicillin, gentamicin, taken with metronidazole by mouth. Yeah, no, just don't hang your hat on this, which is page 66. Yeah, go look up whatever the current recommendations are for these. But
Yeah.
as far as the sickness, as far as the illnesses, the issues, yeah, okay, that's fair. Severe pneumonia, gangrene, infections after childbirth, tetanus, which just all kidding aside, gangrene is just basically dead tissue that's lost blood flow, and the infection is just getting out of hand, and the tissue is dying. Appendicitis, which is just an infection and inflammation of your appendix, which is that little tag end to your where your small bowel goes into your large bowel. Peritonitis, which is more of a general infection of the tissue around of the area that your intestine sits in your belly. And then poisonous snake bite. They talk about antitoxins and antivenom. And honestly, I would probably, for anything that breaks the skin, I'd probably also want to think about, even for a non-poisonous snake bite, you probably want to give some kind of anti-gram positive, probably.
I could get really. Technically, snake bites aren't poisonous. Technically, they're venomous.
The venomous. Oh yes.
I'm one of them.
I mean, if you're a neurotoxin snake bite, you might want to start writing your condolences. And if you're a hemotoxin, don't bump into anything. You don't want to get bruised and get hematorosis and figure out what it's like to be the heir to the Russian throne.
Meningitis. When they're not worried about tuberculosis, you give AMP. When you are worried about tuberculosis, you give these outdated medicines that go look up RIPE therapy, or is it still the full RIPE, right?
It's still full RIPE.
RIPE. RIPE, rifampin isoniazid, parazinamide, and ethambutol. Okay. Vomiting when it cannot be controlled. So yeah, I mean, yeah, okay. Severe allergic reaction or allergic shock, which we just talked about, and epinephrine and Benadryl, that's still fair, you know. Following chronic illnesses may require injections, but they're rarely emergencies. So tuberculosis, syphilis, gonorrhea. So some of those are going to require an injection. When not to inject. Never give injections if you can get medical help quickly. Yeah, I mean, you're gonna, for some of these things, like you're never given you go get medical help, and some things, you know what they're gonna do? They're gonna give you an injection.
I think that's the point they're trying to make, though, is let the people that are trained how to do the injections do them rather than just.
Yeah, that's fair. Never give an injection for a sickness that is not serious. Define. Because so again, going back to Rocephin, right? We give Rocephin. It's a fairly broad antibiotic. It only comes in an IM, intramuscular form, to my knowledge. IV. And IV, but it doesn't come in any kind of oral form. And for a lot of those kinds of things, you're going to give that antibiotic coverage before someone becomes serious. Now, I'm going to play now. On the other hand, the context in which I've seen this is for hospitalized patients or in the ER. So some people might argue that's serious by that point. So
we would give Rocephin pretty. I don't want to say willy nilly, but like
you guys are also giving her
on the border of like why the fuck not?
We're not sure if you're sick down on the border. Here's some epinephrine.
That's scary.
Yeah, okay. Nobody pays me to sing professionally. Nobody's paid me yet to stop singing, but that might happen here soon.
Well, willy nilly is not the correct. We weren't giving it that frequently, but it was something that we would regularly stock, and at least a couple times on an like AT, like so like when we would be like active for like a month, we would give it like a handful of times, and that's across like 1,000 people,
right?
So
I mean, so it's a good preventative. It's just like if you get something that you think might go bad if you let it cook.
And with dudes that are living outside, like we're in the field, not showering regularly, they're already at like an increased risk.
Yeah, and
why not?
And also, I mean, I don't know what the average age was for when you were working with the Army. I know Marine Corps tends to be pretty young.
Yes.
It's like the younger my patient population, the less confident I am that they're going to be able to follow through on doing a full course and remember to. In all fairness, with all the other stuff they have that's going on, you know.
Yeah.
Just what I probably would do in that case, particularly for the modern generation, if they can have, and my generation, honestly, if they can have their phone with them in the field, you duct tape the little baggie of pills to their phone case.
Interesting.
Maybe across the front of the phone, so they have to move it out of the way. It works for keeping people from leaving their babies in their car, you know.
Oh man.
Oh, that's a big sign.
That's man.
Medic,
You have to. Yeah, that whole put something you won't forget in the car seat, so you don't like. What about the kid? Like, is that not something you should not forget?
Next size, an exasperated parent.
Like I've never like gone to the house and like, I wonder where my child is. Oh, whoops! Like, it's the first thing I grab.
You are a functional adult.
Barely. By the loosest of definitions.
No. You're a very functional adult.
Never give injections for a cold or the flu.
Yep.
Never inject a medicine that is not recommended for the illness you want. That just is kind of like a common. That seems really common sense, but like
I think they liked bolding these nevers and like just you know.
Use never a lot.
Yeah. Let's see.
It's quite strong language.
I mean, you could probably boil this down from list from 6 to 4, but it just doesn't have the same. They wanted something that would be at least as long as that little needle diagram they have on the side. It just doesn't the same. But two of these, as far as like, never inject a medicine that is not recommended for the illness you want to treat. Cold and flu thing. It was like, again, I'm not sure why you feel like you need to put that in there, but again,
it's
different audience,
underdeveloped.
One thing that I think is interesting is like never inject a medicine unless you know and take all the recommended precautions. Yes, fair. The only other thing I was thinking about was actually they may not have actually said this. They don't actually talk about like if you don't know what the potential side effects are, which actually I would add that to it. Like you should know what the potential side effects are, because the thing with if you give an oral medicine, you can induce vomiting. You can get some of that back out of them, at least potentially. With IM, it's fire and forget. You're not getting this back, so you better you should be confident that this is what you want to do.
You should be confident.
Yep.
To quote Tom,
Realistically, there is zero situation in which you would do vomiting.
Right. But I'm saying it's possible. It would be at least a potential.
Much more problems,
Yeah. I mean, it's a potential. But to quote the Adventures of Tom Sawyer, are you sure, Peter? Peter was sure. I can't remember what he was going to feed that cat, but it was some medicine he was supposed to take. All right,
we have a list of.
Go ahead.
Yeah, I was just saying now we have a list of medicines not to inject.
Vitamines.
It is better again. Here's that word, their favorite word. Never to inject the following.
Never sounds like an absolute.
Isn't
there somebody on YouTube like the Liver King or something? Like
he openly admitted that he was being a fraud and was taking like a whole blanket of steroids. Obviously, with anybody with a brain could look at him and be like, random dude in his 50s is just yoked and shredded. No, it's definitely he just eats raw liver all the time. It's totally not HGH and tests and D-ball. No. It's liver.
What is it?
Maybe that's what he was doing. Maybe he was putting it into the liver.
What does the IR laser have to do with it? I mean, I'm on board, but what does it have to do with it? A D-ball? D-ball? Dual beam aiming laser?
What?
I thought you said D-ball, DBAL, dual beam laser.
It's a steroid.
Oh, I was a fan. Okay.
Yeah.
I mean, I just wanted to put it on the end of my rifle, but now
there's D-ball.
Okay. Even better.
Yeah.
Does it make target and make me huge? Okay, cool.
It makes you a target.
Help me up, guy. Help. It's like, it makes you the one guy that like shoot that guy. Nobody's gonna be able to drag him away.
Yeah.
Do not inject calcium. Okay, all right. This is legit. Injected into a vein, calcium is extremely dangerous if not given very slowly. Yes. Yes, calcium is an electrolyte. Same thing for potassium. We give sodium as part of a fluid, but like no, that's legit. Calcium, the borrow from some of the things they talk about on prolonged field care. Calcium gluconate is you're not going to cause the vasculitis that calcium citrate will if you need to correct that. But that gets into crush syndrome and some of that stuff.
Yeah.
An injection in the buttock may cause a large abscess. Untrained people should never inject calcium. I think that's fair. Untrained, like, well, okay, train them.
Yeah, if you're not trained and like signed off basically on how to do certain things, like in the army, like it wasn't just like, oh hey, I read on how to do this thing, like so I'm gonna go throw these things in my aid bag and now I can just run around and RSI people. Like no, you have to get signed. Like there's like a baseline set of skills that everybody is like competent and is expected to perform, and then they're like you can get signed off on doing extra things, but like you have to get like that basically that standing order from your PA like to you specifically that you're allowed to do these things outside of the normal tasks and scope of practice of like a 68 whiskey. And that's generally just a good, like if you've never even like thought about trying to do it before, don't. Like the place to learn how to do a crike is not like on the side of the road at the car accident.
Which you still have the speaking of crikes, you still have the contact information for that company that sells the the models that we saw at SAMHSA.
Oh man. I'd have to go do some digging, probably somewhere.
Okay. I mean, hopefully they'll be there this coming year when we go back through. Because I want to do a lot more over there. But yeah, that was really cool what they had. I'd never done a crike, much less. I'd never done a practice crike, but they did it. That was really cool.
They're fairly simple.
Yeah, but
fairly simple.
On the crike, you made a good point as far as the aftercare. What's involved in that? Now they have a hole in their neck. And I don't know the details on that. I'm sure there's that.
Yeah, you got to deflate the bulb every couple of hours, and like try to like readjust it and reposition it so you don't kill all the tissue in the in their airway.
Yeah, so basically you don't create a pressure ulcer.
Okay. Just to add to the fun.
Yeah. All right. Penicillin. Let's see. Penicillin and nearly all infections that require penicillin can be effectively treated with penicillin taken by mouth. Meh. Use injectable penicillin only for dangerous infections. So syphilis, they talked about as far as like injections for syphilis.
Yeah. They say it's more dangerous when injected. Why? How is it more like what is the concern with that?
My guess would be for anybody that's going to have an allergy to oral penicillin, it's going to be worse and much harder to reverse if you give it injected.
I got a bigger mouth though.
I mean, aside from the red man syndrome, right? That's Vank. Okay. Can you get Stevens-Johnson's?
Yes.
Johnson? Yeah, that's almost with anything, but yeah. Steven Johnson, I think, would be more likely with an IM or IV administration where you have skin sloughing. That's not a good day. So yeah, there are certain risks to that.
Okay.
That's fair. But
because I know they've said that a couple of times now, and I'm just like, you can't, why are you like just not like? It would make it stick a lot better. So just being like, it's dangerous, don't do it. Be like, well, here's why.
Yeah, I would like to quantify that as far as like what's the incidence of Stevens-Johnson, because I'm reaching kind of far back to pull that up.
Yeah.
In the old Cortex. So I'm gonna look up FP Notebook real quick and just see if that'll shed any light on us, try and get some actual information on that. Something a little more, like Scout says, you try to quantify things. You don't just give qualitative answers.
Yeah, absolutely. I need to download that app.
It's just a website.
I thought they said something about having an app.
Oh, I think they do. Yeah, you're right. I think they do. I just always go to the website. It's a FP notebook.
Because that was quite handy to read through.
Yeah,
not that I really knew, obviously, but I kept asking questions. I didn't really know what I was doing, but
it's pretty cool. It's pretty cool as far as that goes. Medication categories, just okay. I'm just looking through here, trying to find, and I just want penicillin. That's all I'm looking for here. I'm looking through like all of pharmacology. Somehow I've managed to do that to myself. Gynecology. Okay. HIV, man, we're okay. Okay. Infectious disease. All right. Antibiotics. Okay. We're starting to get there. Penicillin. There we go. We got like the way roundabout. All right. Today. Yes. Let's look at indications, dosing. All right, there's the IM units, and then anaphylaxis and other hypersensitivity reactions, nephritis, which I'd forgotten about. So kidney inflammation, hyperkalemia, high potassium, seizures, and or adverse effects. Fun times.
Interesting.
Yeah, no, they don't give the incidence for that as far as like adverse events. More than 90% of patient-reported penicillin allergy is not a true allergy. So going through
It's
history,
probably true for most like self-reported allergies.
Yeah. So here's the history section under the reaction. Question 1: how old were you when you had the reaction? Okay. Did type 1 hypersensitivity reaction symptoms occur, like anaphylaxis, low blood pressure, throat swelling, wheezing, stridor, angioedema, urticaria? Did a severe type 4 hypersensitivity reaction, which is Stevens-Johnson syndrome, which if you're not eating, go look that up. And toxic epidermal necrolysis, same applies. So how soon? It's basically like if you're not too attached to your skin, go after that. That's great. How soon after the medication did the reaction start? Within 1 hour suggests a type 1, which is the less severe. Was it given orally or IV? Or
Oh my.
That is the appropriate reaction. I know exactly when you looked at it.
I had to unblur it because it's Google.
It's
That is.
It's not good. It's not. This is what we technically categorize as a not good thing.
Straight up not having a good time.
No. Oh. You just made your life way more complicated as the provider.
Yes.
Yeah. A burn ward patient. Essentially. Actually, I don't know if that's even fair, but close enough. All right. I've been I've gone down that rabbit hole sufficiently. Indulge my tism on that. All right, so chloramphenicol or tetracycline. I know I've belabored y'all about chloramphenicol, which is kind of interesting as far as commonly used outside the US, not really used in the US anymore, which means can be an option for drug-resistant infections. Tetracycline, well, that's doxycycline to us now. Okay, IV solutions. Medicines not to inject, and then they say IV solutions. These should be used only for severe dehydration and given only by someone who is well trained. When not given correctly, they can cause dangerous infections or death. I'm not sure where they're going with that, other than like you didn't swallow.
Well, I mean, like, yeah, if you didn't clean the site or like you infiltrate.
Yeah. It's like the picture they showed later with the kid's butt cheek where they got a big necrosis. I will say what this reminds me of was an episode of the Prolonged Field Care podcast where they were doing search and rescue after a building collapsed in Haiti. And they found this one lady in the rubble, and they couldn't extract her, and she's unconscious. And so they're trying to get her fluid back up, and they couldn't get an IV site, so they just keep pushing fluid into, like, they can get a butt cheek. That's what they could get access to. They start doing IM injections into her bottom, and she came around, and the what's his name, the guy who hosts that, Dennis, is like, you kind of have to wonder, like, how much of that was fluid rehydration, getting her volume up, how much of that was the pain of having
Yeah.
it injected into your bottom. Yeah, I have to wonder how
Man,
much.
that's
I could just see that.
interesting.
I could just see that blunt dissecting. That's.
Ugh.
I mean, you can do not blunt. I guess technically hydro dissect, but that's one thing when you do it with lidocaine, but different when you do it with sand.
Jesus.
When you're doing a lidocaine, it's intentional. Like that's what we want. We're going for. But,
yeah. I disagree with their statement that IV solutions should only be used for severe dehydration. I see why they're saying that for this situation, but again, like, I carry bags not for rehydration, but for administration of medications. Like, there's certain things that you don't want to slow IV push. You would rather do a drip. Well, hey, guess what? You can do that with an IV bag really easily. That's why I want. I'm not wasting them on. If someone comes up like, "Hey, man, I need an IV," go drink water, or it's going to be a really uncomfortable IV. Like, I'm either going to go for the foot, or we're going to use your Camelback. Like, and generally people will just go and drink water. It's more effective. You'll retain more of it. I'm not wasting an IV bag that I could use for something serious. I
still want to get a veterinary ultrasound and see if my theory on using an IV bag as a standoff, kind of like a water bath, because so many veterinary ultrasounds, their ideal, like, depth of field is several centimeters or several inches deeper than like a medical ultrasound.
Yeah.
So how you get that standoffs to get where you want your sweet spot to be is, I think what you could do is like what we saw at Soma, where you put gel on each side of an IV bag, and now you have that 3 inches or so. So now because it's tuned, right? It's set up for to get your best imaging in a certain range. So that's just a thought experiment I've been wanting to. So maybe next year I can get into that as far as playing with those things, because yes, I know I can get a butterfly myself, but not everybody can do that. And I'm really trying to get people interested in ultrasound, and veterinary ultrasound is accessible.
Yes.
Not cheap.
No.
There's so much danger in injecting any medicine in the vein that only well-trained health workers should do it. Define well-trained.
Yeah.
Okay. However, never inject into a muscle medicine that says for IV use only.
I can't think of one off the top of my head.
I see that going the other way.
Yeah.
Okay, so like I can see, like, for some things where if it was like, okay, this is designed
like lidocaine.
Oh yeah, for sure. Oh gosh.
Certain doses of epinephrine.
Or vaccinations. But it's like, oh my goodness, the sodium channel blocker. If you have a friend you really don't like very much, and you're just like ready to get rid of them, it's like, as one of my professors like to say, when we're going through chemistry naming conventions, it's like, do this to a friend. Do this to a friend you don't like very much and you don't want to keep. I can drink more dihydrogen monoxide than you can alcohol.
Oh man.
All right. So yeah, don't give lidocaine intravenous.
Yeah.
It's not a form of lethal injection. I don't think it's the form of lethal injection, but it might do the job. Like potassium lethal injection.
It'd get you to the same endpoint.
All right, so
Never inject in the vein medicine that says for intramuscular use only. So to that I wrote
would just
fair.
yes. So so don't give for
IM medications IV.
right,
But you can,
opposite,
for most
I-
IV meds, you can push them IM. You just have to generally, and this again. So we had the disclaimer: it's not medical advice. This is very like rough. Down generally, it's about give or take double the dose. You're also looking at a much more increased time before it to start working when you go IM versus IV.
I mean, think about it.
Like
Think about it. The fact that epinephrine, it's like an order of magnitude, which for folks like me that didn't understand that for a long time, that's like it's a 1 to 10 ratio.
Yeah.
So when you give epinephrine, the intravenous concentration is a 10th, 1 in 10,
Mm-hmm.
compared to the intramuscular concentration. Just because think of your muscle as a buffer, right? So you're putting that in there. It's like a little kind of container, and then it slowly leaches out of the muscle and into the bloodstream, where the capillaries take it up very slowly, versus like you just how do I think about this? Yeah, anyway, didn't come up with a good example, at least nothing that actually makes sense. Something involving landing a Cessna on a freeway, but we'll bypass that. So yeah, like versus going directly into the vein, like you're hitting it with everything you got. So yeah, so I think you could put something IV and into the muscle, but yeah, the time it's going to take for it to work is going to be longer. You're probably going to need more dose to get it to do the same effect.
Yeah.
So ideally you stick with the 5 was it 5 R's?
Yep.
Or the
the 5 R's.
Let's see, I know. All right. No, it's a 5.
It's 5 R's.
5 R's?
Yeah. Yeah.
It's because they're all rights. Okay, all right.
Mm-hmm. Yeah.
The 5
Right.
rights. Okay.
Right dose, right med, right route, right time, right patient.
Yeah. I was just like getting past the word right, and I'm like, but all those words start with different letters.
So for a good example of when I just talked about like the change in dosage for morphine, it is IV 2 to 4 milligrams over 5 minutes, and then the IM is 10 milligrams, and then the onset is 10 minutes. So that's quite a, especially for pain meds, that's kind of like, that's where you need to be more worried about, because you're going to burn through a lot more of your drugs if you're pushing IM, and it's going to take longer. And the other problem, that's why we don't use morphine auto injectors or syrettes anymore, because it would take so long. People would over push too much medication and cause issues. So
I mean, the argument to use IM, it would be kind of like the old syrettes. The whole idea with the syrettes was you get it in there, and now you can move this patient. Unlike an IV, it's not going to come out. It's on board.
Yeah.
You can't stop it.
Well, that's so yeah. For some of them, you can always just do a instead of doing like a full bag. I was quite fond of saline locks. Because now you have an access, and I can convert it to an IV if I want, like to a bag if I want it to.
Yeah.
Or I can just use it as a port to push meds faster with less, so I'm not burning through as much of my, because I only have like what I bring out, so I'm not burning through as much of my supply, and it's kicking in faster like the way I want it to.
Just thinking about like the old school like World War II medics, like they're literally dragging guys at a low crawl or whatever across the ground. Like you don't want anything coming out. That's
if you're having to drag like that, you're not pushing medications because you're not that far into the algorithm. You're just going to drag.
It's a different system now than what they were doing.
So now are we on the next?
So the risk
we are.
Yep. My version.
Yep.
So yeah, basically you're breaking the skin barrier. So, and there are germs there are bacteria that live there. Like it's normal for them to live there. But you punch a hole in their floor, and they're just gonna follow that needle right in there unless you kill them off first before you punch that hole. And of course, the allergic reactions or poisonous reactions. I guess they're talking about like the calcium, for example. If you're too fast or something like that, I can see that first, but see poisonous. So yeah, you're gonna clean that site. After boiling, do not touch the needle with your fingers or with anything else. One thing we were talking about earlier as far as sterilizing needles was the whole problem with, I mean, I guess if you drew up boiling water through the needle, you could sterilize the lumen of the needle. I'm trying to think of anything other than Sidex or
well, I mean, if you you stick it in the boiling water, like it's going to get through the inside.
I'm not sure if a surface tension would do that without like sucking the boiling water into the lumen. Alcohol, yeah, alcohol is the answer. Okay, so alcohol doesn't have the surface tension that water does, but you would still have to draw it up. Yeah, okay, yeah, and that's like alcohol would sterilize it. The inside is the inside of the needle that I'm okay. Yes, yeah, flame sterilization. Yeah, I don't know how long it's gonna take for that.
Just dry heat, because that's gonna break down the pyrogens, which is your, one of the other big concerns that you're not gonna get with boiling water.
Yeah, so like a toaster oven or something similar. Yes, you could do that with the dry heat. Huh. Interesting.
Because that's what with vials in manufacturing, you have to with the glass vials, they have to get depyrogenated to destroy that protein.
Just heat exposure doesn't necessarily do it. Like, just even in boiling water, you have to pull something out of boiling oil. You can 20 minutes before you can sterilize it. And drawing out boiling water for sure is not going to sterilize it.
Yeah, that you're right. I think the alcohol is probably better.
Alcohol probably closes things.
Yeah.
Say using an alcohol swab with a crack.
Yeah, and like what Magmatic was talking about with the pyrogens, basically just proteins that induce the inflammatory response.
Yeah, the fever. Yeah, the boiling water isn't going to kill them. You have to get
the alcohol would break
super
down
heat.
Yeah, okay. Because I mean,
I'm missing something in there.
I mean, because proteins are basically they're a long chain that's gotten folded into. You take a long chain of amino acids and they fold it into a 3-dimensional object.
Yeah.
And, what's the term? It's escaping me right now. Well, when you change the conformation. No, it's more simple than that. It's just, oh gosh, I'm having a senior moment. Just when you like
denature?
Denature. Thank you. I was like, yes, it's out there. It's right there.
It took me a second. I was like, deep protein's not it.
Yeah, denature. It's denature. So yeah, all the amino acids are still there, but they've been disconnected and reconnected in a new way. And what's that? Unfolded. Yeah. I mean, another kind of. What's that about prions? Oh, yeah, prions. It's like the stuff of nightmares. Yeah. So I like to think about it like an egg yolk, like the proteins in an egg yolk when it's clear before you cook it, and then you cook it and it changes so much that the optical quality changes. So it goes from clear basically to white. That's a good example of protein denaturation. Denaturation. Yes, that's a real word. Real word. Unlike neopronoun, but that's a different topic.
Yeah, so you just whenever you're breaking that barrier, you need to make sure that you're being very careful to not damage things. That's why with rather than just boiling, that's why I like pressure cooking, like what an autoclave does, because now you're getting past that surface tension issue.
Mm-hmm. Yep.
Because you're putting so much pressure in there that it's going to get into those spaces. Even so much so, like in your manufacturing autoclaves, they'll actually pull a vacuum before they introduce steam, to make sure stuff's getting into everything.
Okay, yeah, that makes sense. That makes sense. It's like it's literally just the lumen of the needle that has me the most concerned, because like that's just that little captured space.
Mm-hmm.
You got to positively push whatever's in there out. All right. So basically, yeah, you can get an infection, you can get an abscess if you don't do this. Wash your hands. We have to tell people. Okay.
Yes.
All right.
If you can, try to use gloves. That's what we were taught, is to always, we rarely wore gloves. Bad habits being bad habits. And then also just like being in the field, in those situations, like it's not always easy to like stop and take the time to put gloves on.
I remember an episode of MASH where they run out of gloves and they're washing their hands in like this. I don't remember what the solution was. Was it alcohol? I thought it was something else.
So carbolic acid.
Carbolic acid
version that even predated the Korean War.
Okay.
So carbolic acid is fantastic. It's a great disinfectant. It's not so hot for your skin 20 years later.
Right.
But it'll do the job. But if you're using conventional soap and water, just please don't use an antibacterial soap. Please don't. Just use a Castile or a lye soap. That is just actually soap.
Mm-hmm.
Because you're more likely to actually be able to get all the nasties off your hands,
Mm-hmm.
or at least to a point where you run minimal infection risk.
Mm-hmm.
But an antibacterial soap actually will end up selecting for the bugs that are resistant to it.
I would also wonder about what other than just soap, other than just like being able to, what other chemicals am I putting on my hands before I put them in somebody's, potentially in surgery, somebody's body cavity?
Using betadine, iodine, chlorhexidine, if you have access to any of those. Surgical scrubs are just chlorhexidine. And that's what you use for surgical preps too.
And by surgical scrub, you mean like the little brushes?
The brushes.
Right.
Yeah, but they also come just in bottles.
Yeah,
Like,
I'm thinking about the clothes, but I guess that's what most people would think of.
Yeah,
but,
sorry, I didn't
yeah.
specify. But no, for scrubbing into surgery, like making yourself sterile so that
little things that come in the full foil packets with the nail cleaners and the brushes and sponges.
There's a prescribed way of actually like getting to the point where your skin is considered sterile. But the cleaner that's used to do that is chlorhexidine. And yeah, it comes in a nice little foil or plastic packet with a scrubby brush and a sponge and a nail cleaner and all this stuff, and that's fantastic. Or you just keep your nails short. But like for scrubbing into the NICU or something where we don't need to be sterile, but we need to be pretty dang close, then we just use a chlorhexidine hand pump.
I seem to remember a chlorhexidine. Oh gosh, I have to go back a ways, but I remember something about on my surgical rotation, singular, unfortunately. We would do. Yeah. The second one was during COVID, so not much going on there, but we would do like that morning scrub in where we do like the full thing, right? Which for anybody listening, like I imagine, I don't know for sure, but I imagine those little foil packets with scrub in pads and everything. Good item to stock with your gauze. And your gloves.
You can use them for cleaning your patients as well as you.
Yeah, those things. Like if you're thinking about things to put aside, consumables to put aside, like those will be fantastic.
Scrub brushes.
Yep. So we do that, and then we had like a little dispenser of stuff with like
Avogard.
Avogard.
It's mostly chlorhexidine.
Okay, Avogard, mostly chlorhexidine, because they had a little pump on the floor that you hit with your foot and it would spray it into your hands.
Yeah.
That was your other option.
Yeah. So, and that has been studied and shows non-inferiority to a traditional soap and water scrub. as far as infection risk.
Mhm.
So it was just local protocol. It said you had to do the wet scrub at the beginning of the day because institutional inertia, nobody's willing to let go of that yet.
Well, in defense of that practice, I mean, people like, let's say if I'm working out in my garden or whatever, and I've got stuff under my nails.
It's like it is like the surgical scrub version of hand sanitizer.
Yeah,
It's not for use on visibly soiled skin.
right. And it's yeah, I think nails would probably be my thing
Yeah.
with that. Like I want to, you know, I definitely want to go after the little nail pick, and then I want to take the little scrub and just get anything else that I'm not seeing.
But basically, bottom line is chlorhexidine is a fantastic thing, and not many people are allergic to it.
Yeah.
But
So I don't even.
we really need to find a good YouTube video of how to do a surgical scrub, and just put it in the comments to explain what we mean by this.
Yeah, I'll try to look. I'll try to look
Yeah.
at a good YouTube video for that.
A wet scrub and an Avogard scrub, just to show. Like,
Okay.
There's a method for doing an Avogard scrub.
Okay. Wet scrub versus Avogard scrub.
Yep.
Yep, you're absolutely right. Let's see if there's something out there.
All right.
So their list of allergic or poisonous reactions. Okay, hives, swelling anywhere, difficulty breathing, signs of shock, which we're talking. Okay, they say see page 70, which is a couple pages over. We'll look at that in a second. Dizzy
Mhm.
spells with nausea, wanting to vomit, problems with vision, which I guess could be like blood pressure dropping, but I'm not sure. Ringing in the ears or deafness, severe back pain. I'm assuming that's kidney issues. I'm guessing. I'm not sure where they're going with that. Difficulty urinating. I'm not honestly sure where they're going with that. As far as an difficulty urinating as an allergic deal, I don't
Yeah, I've never heard of that.
Yeah. So they got the picture of the kid with a hole in his butt from somebody sticking a needle where they weren't trained.
Mhm.
So there's that. If you want to, it's like here's how it's not done.
Yeah.
And then don't need to dwell on that too much. Like we don't really need to dwell too much on like this is how you don't do it. Let's focus on
Yeah. Well, I mean,
Um,
it's I know you'll get this, but just like with like flying, like you don't tell somebody to not hit the trees, because then they hyperfixate on it and then they do the
Yes.
thing.
Yes, you
Like instead of telling people
hyperfixate.
what not to do, just tell them what to do. And
Hands follow eyes.
mhm.
Hands follow eyes. Which if you don't believe me, ask Kyle Rittenhouse
Oh!
that he shot in the arm. It's
Mhm.
like I think this is something the scout pointed out. It's like he was fixating on the weapon.
Yep.
And that's where the
Absolutely.
muzzle went. That's why the guy he shot in the arm only got shot in the arm.
Yeah.
All right. So let's see. I'm gonna send you actually there's a couple scrubs. One's from 3M Healthcare, another's from Johns Hopkins Medicine. If you search Avogard surgical scrub on YouTube.
Okay. Yeah, I'll throw those in the show notes.
Yeah, let me see here. I will pick that up and I'll send it over to you.
Appreciate it.
Yes, sir.
Just let me get into dangerous reactions from injecting certain medicines. So I guess now we're going to get a list, or maybe not. No, we don't. We get penicillins and antitoxins that are made from horse serum.
Yeah, I mean, I guess that kind of makes sense as far as
I didn't even know was a thing.
Have some sort of antivenom serum.
Yeah.
What's that? I think so. Yeah, like antitoxin, antivenom with horse serum.
Yes,
Yeah,
I
I
know
don't
those
know the
sometimes
common
produce
name
a
right now.
dangerous reaction.
I know it's really expensive.
Yeah, but it when you need it, and nothing else is going to do the job.
Yep.
That I actually had
Crofab. That's right, Crofab.
I had guys ask me that. It's really it's unsettling to be a medic and to have your guys that you're assigned to go, "Hey doc, Do you have any anti-venom? Hey, so real quick, guys, quit fucking with the wildlife. And the reason why they asked that question is because a baby sidewinder slithered through our mortar firing point.
Oh,
And I was like inside a Humvee trying to like facilitate a radio call because we had to evac a guy because he was an idiot and wore his contacts out at NTC. And that dust is called mood sand for a reason, because it's very fine.
I didn't wear my contacts for the Jaeger course because I knew better. I was like, no,
he did it on purpose. He wanted to get out of the field. So
Okay.
apparently corneal abrasions are worth, not having to sleep outside.
You know, it's just like that ground, man. It's just
it was the second time that guy had done that too.
Not a Holiday Inn. That's for sure.
But yeah, so I'm sitting in the vehicle and they're just like, Doc, don't get out of the truck. And I look down, and that was the first time I'd ever seen a sidewinder. So if you haven't, it's really interesting because they don't move like a normal snake. Like they slither, like they do that little serpentine thing, but then they go sideways. And it's very like unnatural and like just freaks you the fuck out. And they're also extremely venomous. Like extremely.
Are they a form of rattlesnake, if I remember correctly?
I don't think so, because I don't think they rattle.
Okay. I think the only Western venomous snake that I like out west, venomous snake that I've run to out west was a rattlesnake. Sounded like a sprinkler system, honestly. It didn't sound like it didn't sound like it does on TV. It's like, no, that's not a rattle, that's a that's what it sounded like. It's not a sprinkler system.
Yeah. So that was a little freaky, and after that point I stopped sleeping on the ground for the rest of my time at NTC. I slept on top of the truck for like 3 days.
I mean, you'd have probably better luck getting profab through a military supply chain than you would
probably
certainly for most of us, dirty civilians, because that's expensive. I think it's in thousands of dollars.
I don't even think our battalion aid station had any anti-venom when we were out at NTC.
I think even in the I want to say even in the civilian system, you have to like I'm sure pharmacies keep it, but or do you have to special order it? I don't remember. Yeah, so like I'm sure they get it to you quickly, but yeah, I'm sure. Yeah, that's a call to poison control first, I guess.
Yeah, you do. It's in areas that are endemic to hematoxin producing snakes or pit vipers of any stripe. It's usually one location in a population center. And they're very stingy about it. And then it can be disseminated to smaller places in extraordinarily limited contexts, like enough to dump a loading dose and then put them on a helicopter.
Okay. Because the number like $40,000 or $50,000 sticks in my brain for cost of a course. It's like no, it's like
no, I don't even want to know. But and a course, quote unquote, is 6 vials. That's a loading dose. Which means that you get your 6 to start with, and you're going to get another 6 over the next 12 hours. And you may need to do it again up to 4 times, especially if it was a baby rattler.
Yeah, because the thing with the baby rattlers is they do not moderate the amount of venom that they give you, right?
To moderate.
They just give you everything.
I think they have made you will get, and you have no idea how much that is.
Holy shit.
And it's also that you don't know how the individual person's hematological system is going to react.
Yeah.
Because basically what you're doing is you're throwing what profab is. It's a decoy. It's something to throw in the body for that hematoxin to chew up instead of your own blood cells and platelets. So it's like you're salvaging. You're giving your body a decoy until all of that hematoxin is gone.
Yeah.
That's insane.
Snake gators sound a lot more.
Yeah, if you're in an area where that's like a concern, invest in some decent snake boots, because it's another one of those situations where prevention is a whole lot easier than trying to treat the actual disease.
And honestly, for just like a regular, like in an austere environment, it's like about it, like that might be just about it.
Yeah.
Other than I mean, I don't even know if like transfusion is going to fix that. I
Oh
honestly
man.
don't know because you've got like broken down red blood cells circulating.
Yeah.
Spleen is going to be overloaded. You're probably going to have high bilirubin. What's that? Your liver's overloaded because it's got to break down all that hemoglobin.
Yeah.
Like our discussion of bilirubin with babies,
Hmm.
now it's happening to an adult. I mean,
Yeah. That's wow.
I mean, and if you have to transfuse this person, you have to do massive transfusion protocol. You then have to do iron chelation.
right, because now they're overloaded with iron.
Yeah,
Because now they got so much iron in their system.
yeah. It's like
Yeah.
your body has no mechanism of losing iron other than bleeding, which means for
Man.
approximately 50% of the population, you have no mechanism of losing iron, but not one that's built in.
Wow.
So transfusion would buy you time, but it comes with
Yeah.
these problems. Another reason to have I don't know. I know sevelamer is a phosphorus chelating agent. I don't know if it's an iron chelating agent or not. What?
Succimer.
Succimer? Succimer. So
Oh shit.
it starts to get complicated
It
quickly.
gets complicated and it gets dark quickly.
Yeah.
And you can't just do packed cells for transfusion. You're going to need to replace platelets and you're going to need fresh frozen plasma.
Yeah. Well, I mean, I'm literally thinking about like
A whole blood.
whole
Whole
blood
blood.
transfusion.
Ouch.
So, because that would be what if you were equipped to do
The
that. with
thought
trauma.
I had is you take 2 donor bags and you pull one off of your casualty and then give them, because now you're pulling out some of that bad blood and then push. But that's just my like.
Now you're spreading the venom to another patient.
No, you're not going to push it to somebody else. This is just to get that like bad blood because like I said, spleen's overloaded. You've got a whole bunch of like you.
The thing is that like you're taking out a lot of still good blood. So
Yeah,
you're getting rid of some of the carrying capacity.
That's,
It's going back to the old fashioned thing of bleeding a patient to help them.
well, because you're going to replace it with known good blood.
I mean, I like the creative thinking, but I don't think that's gonna.
That was the only thing I was like, I guess if it's really, really bad, like if you get to it late, but I think the complications of pulling blood and like the fact that like you can't guarantee that all of that unit is bad, that you'd be pulling off good blood that's doing something.
Yeah, you absolutely could pull off good blood mixed with moist.
Yeah, and that's just going to exacerbate the problem even worse.
Yeah. So
which is like that was as soon as I thought that idea, I was like, well, then you got to deal with like because you're still pulling bad and like that's fuck.
It's more like you do your massive transfusion protocol in whatever shape that takes. In the standard medical world right now, that's anything that takes 6 units of packed cells, generally speaking. And I don't remember what it takes for plasma. It's usually packed cells that triggers it. But you do whatever form that takes, and you deal with your chelation later. If you think
other really simple element to this is again, because if we're gonna be giving whole blood, we're gonna be stressing the liver. No Tylenol.
Yeah.
Tylenol is a go for pain control.
And so many,
which would be seems normally that's something that we would think about, right? But just like Tylenol, so because it's processed by the liver's gonna have plenty to do without giving it more to process. Yeah, there's gonna be pain. So cheerful stuff.
Wow. Okay. Interesting. It's a thought experiment.
Don't mess with the wildlife, guys.
That's the reason it's in every safety brief, Another thing, so since we're on the snake bite thing, do not put tourniquets on appendages that have been bitten by a snake. We had a JAG major that I wanted to throw things at doing a safety brief in Bliss, and he was like, if you get bit by a snake, just put a tourniquet on it because you're preventing the blood flow. I was like, and you're also super concentrating all of that toxin into that limb. So when they go to remove it at the hospital, congratulations, fuckface. And you just killed them.
and you're adding all the joys of the tissue necrosis.
Yeah, on top of that, yeah. Like, let's not. And I wanted to go to him, but I was like, hey man, so I know you get angry at like specialists like doing barracks lawyering. So here's a compromise. You don't do my fucking job, and I don't do your fucking job. Like, just crazy.
The courtroom medic.
Yeah, like let's not do that. Like,
The
I
bad
was
news
so
is, the bad news is because when we take this tourniquet off, you're gonna get all of this venom and all these broken down blood cells. But the good news is we've left it long enough. The potassium overload will kill you way before the venom.
He said that, and the entire medical platoon was like, "Yo, did he just fucking say that?" Like like the PA's like, "Yo, what?" And like all of us are like, "Did that guy just what the no, nope." And like we were like very loudly as we were leaving like this assembly area, we were like, "Well, that was the dumbest fucking brief I ever heard in my life."
All right, so as a guy who is definitely like talked out of his fourth point of contact on more than one occasion, I really try not to do that. Okay, I will err on the side of like I will go look that up, and if I can figure it out, I'll let you know. I really try not to do that because it's just like, oh man, you think you're being so smart, and you just
he did. He like the look on his face. He thought he was doing something, and I was like, "You're a fucking idiot."
Along that, when I yell shift, you're to an L-shaped ambush.
Oh man,
I just had to do that.
Oh man,
No,
that just goes back to like people thinking that like L-shaped ambushes have to be perfectly like 90-degree right angles, and they can't possibly be like a 60 or a 45.
I mean,
like because the picture in the TM says that it's a 90 degree, so that means I have to do because the TM says. And this is the problem with reading manuals with no relevant like understanding. Like, oh, I got the Ranger handbook, so like I know what I'm talking about. Have you been to Ranger school?
About that.
No.
I'm not a tactical guy, but I've done a little learning, and I've had some competent instructors. My question on that is like, all right, you start this exercise with a linear ambush because I assume that's where there's cover. And if you had the cover in the first place to do an L, you would have done an L. So when you're telling your dude to pick up and move into an L, I'm assuming there's no cover there, because if there had been, you would have put him there in the first place, right? So now you're basically asking him in the middle of a gunfight to get up from a position of cover, run out into a position of no cover, and start shooting again. And then just like stay there static.
Yeah.
That doesn't seem like a good
not the move. Not the move.
Anyway.
Yeah. Anyway, to continue on, getting into allergic shock, which people might better known as anaphylactic shock.
It's kind of shock in general.
Yeah.
I don't know of anything in here that's not just shock.
Yeah.
As far as like, well, is there any shock that's not shock? As far as like, I'm not talking about your emotions, or electrocution, but like even like central nervous system shock results in the same thing. I mean,
eventually it all tears down. It's just like, I guess it's kind of getting into like some of that like MOI discussion. Like, well, why are they in shock? Because then you can treat the things that are causing them to go into shock. So like if it's if it's like hemorrhagic shock, well, now they need more blood, so we just fix that problem. Hypovolemia because of dehydration.
Oh no, absolutely. I understand you need to understand like what's the underlying cause of the shock, but I'm just trying to think of anything that wouldn't result in this set of signs, as far as cool, moist, pale gray skin, the cold sweat, where you're in shock, your body is trying to survive, and it's drawing blood back to the core, because you don't care for your extremities, and so
it's just normal shock.
And then weak rapid pulse, your blood pressure is dropping, so your heart rate is going to start rising to try to keep your cardiac output up.
Yeah.
Difficulty breathing. Oh, okay. Yeah,
I think that's the key thing to differentiate it between the anaphylactic shock and just the regular, like, I got bit by a fucking rattlesnake shock is like, okay,
Yeah.
like, can you, like, are you wheezing? Like, can we tell your throat's closing? Because people can just go into regular shock and get hives. That in and of itself is not a telltale. I think it's specifically like that difficulty breathing.
Yeah, difficulty breathing, it seems like, I mean, unless you're getting flash pulmonary edema from cardiogenic shock, maybe. Because I mean, if you had cardiogenic shock where your heart's not working correctly, I could see getting pulmonary edema, getting fluid to the lungs as a result of the heart not working correctly.
Yeah.
So I could see maybe that, but again, the difficulty breathing would definitely go along with it. I know I'm just like splitting hairs at this point.
Oh yeah, yeah.
We do a whole episode just on shock.
Yes, we could actually. That could be, and it would be fun. It'd be a good one. That would be a good discussion.
There's some good stuff. I think with either PJ Medcast for long field care or both, where talk about shock. Like you got actually like not me. You got like critical care docs talking about how shock works and all that kind of stuff. So
yeah. So when we talk about like with medications, like a good, like everyone always, like whenever you think of anaphylaxis, everyone always like jumps to like, oh, EpiPens, epinephrine. Well, like there's like a, before we go to that, like you just take some Benadryl. Like at the early signs of it, because like the cost of you being wrong and not needing it, if you just take some Benadryl, they're a little drowsy. That's a lot better than like, oh, well, he's looking like he might be going into shock, and then you like hit him with an EpiPen, and now like we've potentially made things unnecessarily worse.
it depends on how sick they look.
Yeah, it's one of those, like, it's all situationally dependent. Like,
so let's unfold that a little bit on the Benadryl, the antihistamine versus the EpiPen. What are we talking about here? So with any antihistamine, whether that's Claritin, Zyrtec, or Benadryl, diphenhydramine, and I'm not talking about the ones that affect the stomach. We're just not going to get into Pepsid and all that kind of stuff. Although you can, but anyway, that's not really what I'm talking about. So histamine is just that. It's that, again, a messenger, a cell messenger that tells special the general purpose immune system, like the called mast cells, to dump their contents, and it basically causes all this swelling, recruits all these other cells from your immune system to the area. But basically what's going to cause you problems is the swelling, because now you have tissues that are supposed to be a normal size, and they beefed up and they got real plump real fast. And when that happens in your airway kind of need that to be open. It needs that to be, nice big honking airway. And then you get fluid and swelling into that area, and now you've gone from a 4-lane highway to a 1-lane road, and things are not good, assuming you still have that 1 lane. And you just, it's not a good day. So the antihistamines are there to try to interrupt that cycle, interrupt that process as it's happening. And then your epinephrine is, I think it's more really, that's more when you're looking at where you're having a drop in blood pressure. That's really, it's going to basically, so your epinephrine is going to squeeze down those blood vessels.
Yeah.
So in the case of dropping blood pressure, where the blood vessels are just wide open, blood vessels stopping, blood's not getting where it's supposed to go, then the epinephrine is going to squeeze that blood, cause that blood vessel to constrict and keep your blood pressure move, up and blood going where it needs to go. The other thing with epinephrine is that, all these inflammatory products that we were talking about have to get to that site somehow, right? That's going to be the bloodstream. So when we give epinephrine, we squeeze those arteries down, and so we're slowing the delivery of all that, all those problematic things that are responding, all those first responders, all those ambulances that are crashing into the same area and causing a traffic jam, causing more problems. All right.
Yeah.
So I just this picture right here. Does anybody else think that looks like Beavis and what's his face?
Beavis and Butthead.
Yeah,
Oh,
that.
wow. Yeah. Holy.
I'm
Wow.
sorry. Somebody is looking at me like that with a needle. No, I want someone else. I that's far too fixed to stare. I agree with the guy like the dark haired guy. It's like, what are you doing?
Oh, yeah.
Yeah, no, just picking on the artwork a little bit. Um, okay.
Yeah.
So
That's yeah, asking asking if you ever had an allergy, that's part of making sure it's the right medication that are right drug. You're ensuring that they don't have any allergies to it. So
yeah,
that is an important thing to ask before you give any medications, to make sure that they are not allergic to it.
yeah, and also don't ask that question while you got the needle suspended over the site. In this case, their butt. It's like, so have you ever had? Dude, you should have been having this conversation. Unless this is an emergency or something, like you should have had this conversation before you drew this stuff up.
Oh yeah.
Yeah,
No. No, vaccinations is the time to fuck with people when you have a needle in your hand. That's yeah.
Heard it here first.
Yeah. Oh, we would do it all the time. That's half the fun of doing like battalion wide
you probably
vaccinations.
you probably actually aspirated with a needle, though, right?
Well, did I talk about? Oh, or have we gotten to that part yet? Because I think I.
Did we talk
Oh,
about that?
it's in another page. We'll get to that because
Okay,
I
all
wrote
right.
some stuff.
We're gonna get
But
to that. Okay.
yeah, for doing the vaccination things, I would always like mess with people. Like, are we sure this is the right? Fuck it, and just like, because the guys, like, especially when dudes were like already nervous because like they didn't like needles, they'd be like, "Is this the right needles?" Yeah, it's probably. You know, what's the harm of it being too big? And like you just like stab them with the needle.
Not a nice man. You're not a nice man. Ah, this is the difference between like this is the army way. Yes.
You gotta have fun with it. And so we weren't doing this to everybody. It's people that I knew that like you have like established a relationship with him, and the male chiding. On ampule, something I wrote down because they didn't. They not once in any of this so far talking about ampules have even said anything about filter needles.
Yes.
That is
Koala Bear brought up as well.
That is something that I so not even just in medication or in medicine, but in manufacturing. One of the things that we used at another place that I worked to test the like chemical concentration of the medicine that we were manufacturing, we had to standardize the machine, and the standards came in ampules, and we were having issues with the machine failing standardization. And I was like, well, we're not using filter needles. And the guy like looked at me. He was like, what? And I was like, we're using ampules. And he was like, yeah. I was like, so we're introducing a bunch of glass particles into this solution, into this standard, and we need to use a filter needle to flush that out. And then you can take that needle off and just push the syringe into the testing port. And they were like, how do you know this? Like, this is a thing? I was like, you just broke glass. Like, what do you like? You just expect like there's some like barrier like on the ampule.
What they don't realize is that they're in like the origin story for the comic book character Silica Man. He gets an injection of radioactive glass, and he turns into a troll. Silica Man.
So yeah, when you're breaking ampules, which are all, for those of you that don't know, they're the all glass like vial looking things with like the pointy, like the Stahlkube point on the top of it, instead of like a normal cap like you would see on like what traditionally people think of as a vial.
I love how you reached over your head to illustrate, and I can't even see that.
Well, because the stall cube, the German, like the World War One helmet, they had the pike on the top of the helmet. It's
okay.
got like that little spike looking thing on the top. That's what I thought of when looking, like trying to explain an ampule.
Hat to me, but anyway.
And to open those up, you literally, I mean, you have to like crack them open, and there's obviously you just broke glass. There's glass shards, like little teeny tiny, little small little particles of glass all in that liquid now. So you have to use a filter needle to draw it out of the ampule, and then you have to take that off. And either if you're going straight to a lure hub, or if you're using a needle port, you have to get a different needle to push that medication. Otherwise, you're going to be injecting tiny little silica particles into the medication. And this is something that, like, whenever you learn about ampules, it gets talked about. And these guys in this manufacturing setting had never learned how to inject somebody with something from an ampule, obviously, and were wondering why they were getting particulate counts over the limit. And I was like, well, because you're not using a filter needle. And everyone was like, what are you talking about? And I was like, this is a thing. Like, I'm not crazy. Like, I promise you, this is like a real life thing.
As I like to say, I'm not crazy. Well, I'm right about this.
So that was something they didn't bring up in here, talking about ampules. Because again, this book was written in the 70s, so they have ampules of epinephrine ready.
Yeah. It's like still not the only form anymore, but it is still a thing.
Yeah, I mean, they definitely. So yeah, the ampules, because it's completely sealed, I guess in theory, like the whatever it is, you're less concerned about the storage vessel deteriorating, and now you're only concerned with the product inside of the vessel going bad in storage.
I mean, unlike
versus a vial that uses a rubber stopper being held on by a metal clamp.
Like there's no rubber to degrade.
Yeah.
Degrade. I mean, for really storage.
So it's definitely an option. There's kind of a little bit of an art to breaking an ampule. But it's not hard.
I think how I've seen it done and got a little bit of practice, like you take a little bit of gauze and wrap it around the neck of the ampule, and then just crack that up. And
just use an alcohol prep pad. Since you already have those available when you're doing injections anyway. You just one on top, one on bottom, and you just put your thumb on that. If I can put your thumb on the break point and just one sharp, quick. And you can kind of like stress it a little bit going all the way around.
Yeah. I guess I would try to keep it as vertical as possible so I'm not dumping contents on the ground.
It's vacuum locked, it won't dump.
Oh.
Because you actually flip the ampule upside down. Same like you would with a vial to pull the medication.
Oh, wow.
Yeah.
Okay.
The surface tension of the fluid will hold it in that.
Interesting. Okay.
And that's how it maintains sterility too.
Okay. So yeah, you've obviously done a lot more of that than I have. So I didn't even realize that you could do that.
Yep.
Cool. Very nice. Going back to the whole don't pretend for stuff that you don't know.
Yeah.
Ask questions. So they talk about staying with a person 30 minutes after injecting. I think that's common, like 15 nowadays.
It just depends. I think it depends on the medication, if they've had issues before.
Yeah. 30 minutes is long. It's just not as commonly done anymore.
The only time I saw 30 minutes is when we were doing the anthrax vaccinations. If you had fainted before from an injection, if we were doing anthrax, we would have to sit and watch for 30 minutes. And then this talks about, so their protocols for epinephrine, I think, are a little, I had a question mark, because it talks about if they look like they need epinephrine, it's just to dose half an ampule. And then it says to repeat in 10 minutes.
My question was just a muscle or just under the skin. Like, well, do you want it IM or do you want it sub Q? Because pick one.
Those are
I'm confused.
And then to just repeat in 10 minutes. What?
If necessary. I mean, I guess. I don't know. I mean, I actually don't have as much of a problem in the 10 minutes. Like, if they're still like not responding to that.
Yeah.
Okay. My question was more just like, well, what route do you want? Do you want IM or do you want sub Q? And if there's one what do you want? I just not sure. Okay.
Yeah.
And then I'm on page 72.
Yep.
Syringe for injection.
Yep.
Take it apart, boil it, and the needle for 20 minutes, assuming you're below 3,000 feet, by the way.
Yes.
And then I know, I just keep hammering away at that.
Yeah.
I'm not assuming that everybody who's listening to this is listening to me rant about it in other podcasts.
So this boiling thing is only for glass syringes. If you have prepackaged like in the plastic syringes, please don't take those apart
boil my needles
and then boil it. Because I wrote that earlier on one of the other pages where it talked about on 68 where it said risks and precautions. It was like it's important to boil the needle and syringe before injecting, and I wrote glass syringe. Like I please hope you're not telling people to boil plastic syringes and plastic hubbed needles.
I wonder if you could get away with that with a pressure cooker though.
I don't know. Yeah. So because pre-filled syringes are terminally sterilized, so they have to run through an autoclave for them to be considered sterile.
Yeah, I think you could get away with that potentially. Obviously, not all plastics are created equal, but
yeah. So how they for most of the things that you like in like the plastic items, because the concern is always like, well, how do they handle the heat? Well, most of the time they gamma irradiate those. They'll use gamma radiation to sterilize them if it can't handle the heat.
Okay.
Just fun little tidbits.
Pretty decent little step-by-step. Illustrate a lower lock needle, but that's okay.
Yeah. And I love how we have a vial of freeze-dried medication, but we don't have a vial of diluent. We have an ampule of diluent. I just thought that was interesting.
Oh, an ampule of diluent. Oh, okay.
Which they call distilled water, which is not diluent is not distilled water.
Yeah, I don't know enough about that to speak.
I've made diluent like a lot. And it's, I mean, all it is just it's sterilized water. It goes through the normal process to be called water for injection, which is the stuff you have to use to create injectable meds, and then it has to go through a 0.22 micron sterilizing filter.
So you might start with distilled water, but that's not the same as diluent.
It's triple distilled. It's reverse osmosis twice. For it to be, there's like 12 steps that it has to go through for it to be considered water for injection in manufacturing. There's several steps to make sure they get everything out of it, and then it gets tested weekly. And then again, like I said, you still have to run it through a 0.22 micron filter before it's actually like ready for use. And then our stuff that we made at the other job that I had, that stuff would get run through an autoclave as well, just to like one final guarantee stop.
So question on that.
Yes.
I'll say an answer. Okay. What is the filter size for a Sawyer mini filter? Just for reference. I'm not saying it's going to be the same. I'm just so I can conceptualize.
I don't know. I don't know what that size is, but per the FDA, 0.22 micron is what's considered a sterilizing filter.
Let's see. So they give it on the Sawyer website. Deny cookies. I deny you. Gives me the dimensions, tells me it gets out. Okay. High performance 0.1 micron absolute inline filter. Okay. So that's 0.1 micron. And what did you say the other thing was?
0.22.
0.22. Okay.
Yeah. But this is I don't
bigger. That is bigger than the Sawyer.
Yeah. And again, there's other steps that have to go through because it gets filtered.
And you said reverse osmosis.
Yeah. Twice. It gets distilled. I believe twice as well. It goes through a chemical treatment process because that's like taking like tap water and turning it into WFI. It's a, I can't remember. I'd have to go back and I don't have access to the slide deck, but it's a process to create WFI.
Just how close you could approximate it with commonly available materials. Or
You can buy like pharmaceutical grade filters on Amazon, like smaller ones. Millipore, Millipore. It might be Mille. I'm pretty sure
And
it's
another thing,
Milli.
you can get reverse osmosis
Mhm.
stuff. So a lot of sailing boats have that.
Yeah.
Just thinking about it, yeah, again, probably not practical for the amount of like for economy of scale.
Yeah.
But just like, interesting. Like I think it might be achievable. I just don't know what the
Yeah.
process would be. And
Yeah.
obviously, like not like for massive quantities like you would need to for a factory, because obviously that's why they do it in the factory.
Yeah. At a much smaller scale.
They make a good point about like rub the top of the bottle with alcohol, like sterilize the
Yep.
top of the vial.
Yep.
The rubber vial.
Yeah, anytime you want to, you're going to go, because, and so that's another thing. So for some vials, the vial itself is not a dose. For some vials, it is. For some vials, it's not. So you might be going into a vial more than once. Every time you go into that vial, wipe it down with an alcohol wipe. Same thing with your needle hubs. On either that be IV tubing or on a saline lock, you want to wipe that with alcohol and let it dry. Emphasis on let it dry.
Yeah, and that's not just we're gonna try to avoid irritation of like alcohol into a wound, but it's like to let it do its job. There's something called dwell time
Yep.
with a lot of I remember that coming up, not just for alcohol, but for other.
Yeah, any cleaner has a dwell time for it to do, or for it to achieve full efficacy. For me to use the big fancy words.
Fancy words. We've blown through our whole $2 word budget. Okay.
Yeah.
Okay, so I guess yeah, I mean I think page 72 is pretty good. It's like if you have no familiarity with how to give information, that's pretty good.
Yeah. And this page is specifically for something that's been freeze dried. If you have medication that's not been freeze dried, do not dilute it with diluent. Because now you've just thrown the dosage of that vial off. So you'll just be drawing. You'll be skipping, what is it, steps 4, 5, 7, and 8. So you're just like, you're not going to do anything with the ampule. If it's already like a liquid, you'll just draw it up and dose it.
On the vials, they're usually marked as single or multi-dose
Yes.
vials.
Yeah.
Kind of
yeah. But this is specifically for stuff that's freeze dried, so it's in a powder form. And that is generally done for storage considerations. If it's something that can handle just simply refrigeration, you freeze dry it. Now you don't need to refrigerate it, and it will last longer. Some medications, even after freeze drying, have to be kept in cold storage. Looking at you, MMR and varicella vaccines, those have to be kept even with being dehydrated. They're so like unstable. They have to be held in cold storage, even with being freeze dried. But for the most part, most freeze dried medications are less temperature or more temperature resistant than the liquid versions. Anything liquid generally has a lower shelf life.
I'm trying to remember trying to remember if an MMR vaccine is a live vaccine or an attenuated vaccine.
I do not remember.
MMR is live, right? And varicella, does that? So I'm wondering if that's part of why it has to be refrigerated too. If it's an attenuated.
With it being live, would it be able to survive the freeze drying process? Because I mean, that's pulling like a vacuum and going down to like 40 degrees or negative 40.
I'm not sure. I'm just trying to remember, because I remember there's certain live vaccinations or even like attenuated vaccinations that you do not give to pregnant women.
Yeah.
But like I want to say, see. So make sure they're okay. So vaccinated before they get pregnant. I think that's because it's an attenuated vaccine. which is to say live but weakened in a way, as far as like it's not infectious, but it gives you just enough. But technically, it's alive. I'm wondering if that's part of why it needs to be refrigerated as well.
Could be.
No.
We never really had that explained to us. That was just like the stuff we used in the army was freeze dried and had to be kept in cold storage.
Yeah, I just like just to kind of just made me go like, huh, interesting.
Yeah.
That kind of one of those moments, which is one of the great things about this whole project is like, interesting. Why is that?
Yeah, it makes you think about a lot of stuff. I've
Yeah.
already, I mean, we're 9 chapters in, and I've learned a wealth of information just from reviewing this, which I hope you guys have as well. And that's me talking to the listeners. I hope you guys have learned something out of this and not just,
Or at least you're entertained.
I mean, you're definitely that.
Or you're just mad. It's like, I wish
Yeah.
you guys don't know what they're talking about. Shut up.
Yeah. One thing on the reconstituting freeze dried, make sure that like everything is become reconstituted. There's not any powder in the vial. Not only is that like not a good idea to try to inject a powder, but you're missing out on medication. The more important concern is that you're shortening the dose. You're shorting them on that full dose that they are supposed to be getting. So if we're going to go through this trouble to make sure that we're giving them a sterile medication through a sterile route, let's give them the whole fucking medication. And then we get into where to give an injection.
I think I gotta say, like, for the model for this picture in the upper left corner, that is commitment, where you have dash lines tattooed on your posterior. Like a correct
Yes.
model for this.
Yeah. You're gonna be going for the
Oh.
upper outer quadrants, so which is what he's talking about with these dotted lines on this picture. Generally, like, so if you've ever received a shot into your butt, it's in the upper outer quadrant. That's where should be.
Because if it's on the upper inner quadrant, you might have gotten an injection.
So that's generally where, so if you ever like spent time in the military, that's where the peanut butter shot gets injected. And it is, for those of you that don't know, it is called the peanut butter shot because it feels like a vial of, or a syringe full of peanut butter is getting injected into you.
Sounds yummy.
It's just a very broad spectrum antibiotic they give you once a month because you're interacting with people from all over the country, from different biomes with different stuff. But it doesn't help because everybody still gets sick at boot camp.
Huh.
Everyone comes down with something at some point in time. So
they wouldn't do anything for viral.
Yeah. That's just one location. So stuff that's IM, this is where you'll dose it. You can also do the outer thigh, like the upper outer thigh, where they tell you to put an EpiPen, like in that meaty portion of the thigh. That's another location that you can put anything IM. There's other ways to there's other ways that you can inject medication outside of IV and IM. There's sub-Q. There is also.
Yeah, one thing I want to point out on the thigh thing, because there was a band of tissue, of fascia between your hip and the outside of your knee.
Mm-hmm.
I mean, like the outside of your hip, where your holster would normally be, all the way down to the outside of your knee. There is a line of tissue called the IT band. It is very sensitive.
Mm-hmm.
So try to go forward of that.
Yeah, you don't want to go completely. The technical term is medial, but the middle. You want to go like just kind of above that.
Yeah, more toward that front pocket on your Cry Precision pants, or your Amazon knockoffs of Cry Precision pants. Let's be real.
Where that first section of the fold is on your cargo pocket, like that top part of the cargo pocket. That's a good place to
more relatable
to go. So there's tons of locations. It all depends on the medication. That's a whole separate thing. This is not the time for you to learn how to do injections. That's a different. This is some basics. And then how to inject. We have clean the skin with, they say, soap and water. Alcohol prep pads are cheap and you can vacuum seal them. So just buy a lot of alcohol prep pads.
Soap and water better than nothing, but I would slather hand sanitizer on there if I had nothing else.
Yeah, just
Wipe
clean it off.
Yeah. I do want for the record to say I do not have quite precision pants. This is my camo pants are all hunting pants. All right. So.
Yeah, I don't think he even owns anything in any sort of it was ever once issued camouflage pattern.
Exceptions, but yeah, no, not so much. Mossy oak militia all the way.
And it says to put the needle straight in. When they say straight in, they don't mean like parallel to the ground. They mean parallel to that plane or perpendicular to that plane of the skin. I'm sorry, not parallel. So instead of being like perfectly perpendicular to the ground, you don't do that. You're perpendicular to that plane of tissue, whatever it is.
So wherever on the skin you're putting that needle, you want that needle pointing straight at the skin.
Yeah.
Wherever that little patch of skin is, you want to point that needle pointed straight at it.
Yeah.
You're gonna do IM. Like if you want sub Q, you're gonna come in at an angle, but
yeah, that's a little different. And then before injecting, and this is where we're gonna get to if somebody here that listens has, and realistically, it's probably going to be the nurses that are going to have a problem with this because these are the ones that had problems with me doing this. This says to pull back on the plunger, which is known as aspirating, because what we're verifying is that we're not in any sort of a blood vessel. Again, like we talked about earlier, IM, higher dosages, because it has to get absorbed. And the reason for that versus IV is that with IM, it has to get absorbed through the muscle tissue, and then it slowly works its way into the bloodstream. With IV, it's going straight into the bloodstream. So it's a lower dose, it's going faster. So we want to make sure, since we have decided to give this drug IM, we're at that IM dose. Let's make sure we're not in a blood vessel. So aspirate, it takes all of half a second. It doesn't cost you anything. It's a good little peace of mind just to make sure. And then
there are also some other issues that have come up with like the lipid soluble forms of some vaccines.
That too.
This was meant to go into a muscle, not a blood vessel.
Yep. So for vaccines and stuff like that, that's another concern as well.
The fact that I have to like argue with a pharmacist to pull back on the plunger for giving me this, like I have to get into this long discussion with him to get. I don't understand.
Somebody read one study, and so now we have to throw away 75 years of evidence.
They read one study and then extrapolated it to everybody, which we know pediatrics are just tiny adults. There's no difference, obviously.
Yes.
Sarcasm light is on.
I'm surprised you didn't get something thrown at you.
I don't live with a nurse.
Well, I just meant the babies being tiny adults thing.
Oh yeah, no, yeah. No, she knows. Yeah, she knows. That is definitely sarcasm. I hear about the differences on a regular basis. It's very, very
so like I said, we're trying to make sure we're not in a blood vessel. We'll know we're not in a blood vessel because we're not going to see any blood.
Amazing how that works.
It's crazy. It's wild. It's absolutely insane. So aspirate. This is me telling you to. If you're a nurse, get mad, email me. I'm not going to read it. I don't care. And then we have remove the needle, and you want to pull it straight out. You don't want to try to like bend or just, you go straight in and you come straight out.
Controlling to come out the same way you go in.
Generally. And then this has, because I'm assuming they're probably talking about using glass syringes and glass hub needles to take the syringe apart and wash it.
Yeah, nowadays we have Sharps containers,
which, if you haven't thought about that, you thought we went on a rabbit hole talking about antivenoms. Where are you going to put all these dirty needles so you don't reinfect your community with all the nasties?
Yeah, good thinking about.
And now we have an entire page or a section on how injections can disable children. This has to do with, from what it looks like, it has to do with vaccinations, and a couple of other different things. But there's a vaccination timetable for a reason. You don't give all of at once because that's obviously dumb.
Yeah, your
Um,
immune system can really only take on a
yeah,
certain amount of vaccination at a time. Certain like
yeah,
we talked about with some of the attenuated vaccines like MMR.
yeah.
Yep. What, what's that?
Yeah, good talking to you again.
Okay. You are a lot more educated on this than I am. So as far as like how many, I know there are a certain number of vaccinations, a certain timetables for children,
Yes.
right? And I know like when COVID was a big thing, they didn't want to do shingles vaccines at the same time as COVID. They would do a COVID vaccine.
Live vaccine.
Okay,
We don't do live vaccines in proximity to anything.
fair enough. Okay. But they would do like a flu vaccine with the thing that combined with the COVID shot, right?
Flu no longer comes to live vaccine. Only a kill vaccine.
Right, right. So it just depends like what kind of vaccine are we talking about, right?
Yeah, so the ones you get fussy about how they're timed with other things are your live vaccines. So rotavirus for WTiND babies and MMR, measles, mumps, rubella, and varicella. But the point being, you could give literally the entire childhood sequence of shots all at one time. You have a very angry child. But you could give every single injection for all of those all at once, and you still wouldn't have the same number of antigens that any one of the three of us talking here got in one single pertussis whooping cough shot as a child.
As far as like Tdap, tetanus, diphtheria, and
Pertussis
pertussis.
alone.
Pertussis. Oh, so you're talking about the amount of antigen load.
Yes.
Gotcha.
The antigen
gotcha.
load is what people get all fussy about because it's like it's so much for the immune system to handle.
Yeah.
There's so many different little things, it's little samples that the immune system is being presented with to recognize, remember, and then file away for future reference.
Yeah. Because what were you telling me? Like the raw numbers of antigens has been trimmed down from something to something, but I don't remember the numbers.
So for example, the original vaccination, smallpox, was 300 antigens.
Okay. For
In
smallpox.
the neighborhood, it wasn't exactly 300, it was 300 and change. I don't remember the precise number. But that was 300 antigens by itself, single injection. 300 things the immune system had to sort through, figure out, memorize, and file away. One single injection. You know, and other vaccines, measles, polio, things like that were added as well as smallpox. And so the body is getting 50, 60 plus more antigens to recognize with just those two other vaccines. Time goes on, they keep adding things to get Haemophilus influenza, which causes a nasty pneumonia. It's not a flu virus, despite the name. And it's like you get other forms of polio vaccine, you get your tetanus shots, all these things until by the 80s or so, you have a pretty well systematized childhood vaccine system. Well, somewhere along in there, the whooping cough vaccine occurred. And what we are familiar with now as a Tdap or a DTaP is a triple vaccine, which includes tetanus, diphtheria, and acellular pertussis. However, the acellular pertussis did not become standard until the mid-90s. Before that, it was whole cell pertussis, which meant the entire whooping cough bacteria was tossed into it with someone cooked up a whole bunch of it in a lab, tossed it into a pot of soup, cooked it down to it until it was dead, and then put it in a vaccine.
Okay.
Very inelegant form of describing.
Right. So the acellular is basically you're getting the pertussis antigens, but not the whole dead cell.
The whole cell had 3,000 antigens put into a vaccine with diphtheria and tetanus and given along with 10 zillion other things and the vaccine schedules. That's what, assuming all three of us had the typical childhood vaccine schedule at our ages, we all got that.
So at this point, antigen load has been reduced from like the thousands into the hundreds.
Correct.
For
the
all those
entire childhood shot series, again, if you added all of them up, is around 300 antigens now.
Gotcha.
So the same as that one original smallpox vaccine.
Right. Okay.
That it's the same number of things your cells have to recognize and remember.
Gotcha. And then with the, as far as I don't know of a live vaccine that's not an attenuated vaccine as far as a vaccine that's not like in some way weakened as far as its ability to reproduce and infect.
So live attenuated vaccines are designed for a person with an average immune system. It is not capable of being virulent, meaning that it is weakened to the point that in someone with an average normal immune system, it's not going to cause disease. For someone who has an immunodeficiency, whether that's just innate to them, they were born with less of an immune system, or whether they're having something that causes them to have less immune system, they're an organ recipient, an organ transplant recipient, they're
Chemotherapy patient,
immunosuppressive
HIV patient,
patients, yeah, exactly.
yeah,
Those are
radiation,
classic
yeah.
ones.
Like somebody who just is in the process of getting like a bone marrow transplant.
Correct.
Yeah. Okay.
Bone marrow transplant's like their ultimate bubble baby
Yeah.
situation.
Yeah.
It's bubble baby just being alliterative at any age.
Yeah.
It's like someone undergoing a bone marrow transplant has no immune system effectively.
Right, because your bone marrow produces your white blood cells.
And
It produces your immune cells.
And you literally have to kill that off to be able to successfully do a transplant.
Yeah. Because ironically enough, you're transplanting what makes your immune system,
so
but you can't have an immune system to react to it. So yeah.
But live attenuated vaccines can cause disease in someone who is immunocompromised, again, either whether it's innate to them or it's iatrogenic, meaning in some way, shape, or form something happened to make them that way.
And there's an exception, I think, to this, even when we look at like the oral polio vaccine, which isn't used in the US anymore.
It's a live attenuated vaccine.
Right. So as far as like, so you have people develop polio who aren't necessarily like immune compromised, at least not that we know of.
That's because there is the possibility of it's not a wild type polio that they use for the oral the oral polio vaccine.
Right.
They use a lab generated attenuated version, but because it retains its genetic material, it has the possibility of reverting to a wild type form.
So basically,
once it's in a human body.
Yeah, so you take this attenuated live, all attenuated viruses are live. To say live attenuated is redundant, but we'll say that just for lack of confusion. So you take a live attenuated polio virus, which is the oral polio virus. So we're not using that in the US anymore. Polio viruses are injected, they're dead. Vaccines are dead in the US. The oral though, which is mostly used, and it's like a lot easier to keep up with logistically. Yeah, so it's oral, and for all the reasons that they're talking about, much safer to administer because it's not an injection. Still used in places like northern Nigeria and Afghanistan.
I think the only places where polio is still endemic.
Right, still endemic, and still endemic for a lot of the same reasons.
Yeah.
Islamic militancy is part of that. But anyway, so while these oral vaccines, so you put the attenuated virus into the patient, gets into their system, starts reproducing, and sometimes it will mutate back into the virulent form and cause polio.
It's rare.
It's rare, but it can happen. So that's
removed from use in the US.
Right. That's why we don't. Right. But like that's the exception to you have to be immunocompromised to be for an attenuated virus, attenuated vaccine.
I am not aware of any situation in which rotavirus or an MRV has ever done that.
Right. Yeah, not that I know of either, but I just wanted to note that noted exception, which would be the polio, which would be that I can't remember if it's Salk or Sabin, but I just keep with it injected in oral.
This is OPD.
So they keep that in mind. Then when you look at people coming into the country who had an oral polio vaccine,
how long ago
was it? And is there? So sometimes they'll have polio cases show up in places like New York City, and like it'll be in the sewage because they monitor this kind of stuff. And it'll like the polio virus that they'll find is derived from those vaccines. So it's just something to keep in mind, So so even though polio is not something that we see a lot in this country anymore, it's still a good thing to keep up on as far as vaccination.
Yeah. There are other useless trivia fact of the day. There's still 2 people in the US who use an iron lung from childhood polio infection.
Oh wow.
Yeah.
How old are
Interesting.
2007.
Yeah. Okay. Have to be born around there. Yeah. So that was a 50 thing.
Yep.
Yeah.
But that's why it's still on the that's why the iron lung is still on the list of medical devices that that makes you exempt from ever getting your electricity cut off.
That's a whole separate discussion.
Wow.
Well, the whole letter. You wanna give us a little thumbnail on that whole like gaming the system?
So yes, not really, but okay. So their physicians will be asked on occasion to fill out a letter of medical necessity saying that this person has a life-threatening condition that requires electricity for something life-sustaining. And basically it's for families or individuals who are not very well off, or something has gone wrong and they're unable to pay their electric bill. It prevents their electricity from being shut off legally. If they have a form of medical necessity from their primary care physician.
Interesting.
Or the specialist who is responsible for managing this device. It's designed for, 50 years ago for the iron lung, and now for like trach vent patients.
Or even somebody on an oxygen concentrator,
Right.
maybe.
Yeah, it's like,
But it's used for a lot of really silly things at this point,
Yeah,
isn't
it's
it?
designed for something that truly would be, it's like, if they lose their electricity connection on this, they have hours to live.
Mhm.
And because all these things, like, okay, they'll be fine for a little while, but they're gonna rapidly degrade.
Mhm.
So it's designed for that. It's unfortunately used for really stupid things, like, oh, they have an epidural nebulizer for the one time a year that they need it. Or
Yeah, which is like you plug it into a wall, right?
Yes,
It's not like a
yes.
puffer.
Yeah,
You
that's
actually go
why-
and plug that into
yeah.
the wall.
It's a less preferred device among patients who are anything older than a year.
So this is so that letter is something from what you've told me. People are advised.
There are certain
to pursue
populations
this.
of people that are advised to pursue this and are not. The education is not good on it. It's used as a way of quote unquote saving money. And it's not used in appropriate situations. I've seen it literally used for liquid Pediasure, for oral supplementation for a child
To refrigerate.
for a child who is not dangerously underweight. It's like it was a true supplement, not a requirement, not a G-tube fed. This is their full-time food.
But because they had the liquid Pediasure, it's like, oh, you've got to have your refrigerator run, so you can't have your electricity cut off.
I will also point
Whether you
out
pay it or not, pay your bill or not.
Pediasure comes in a powder as well.
Yes,
that
it
does
does.
not require refrigeration.
Yes.
But I've literally seen the liquid Pediasure prescribed to be able to write this letter.
Yeah.
Wow. That's wild.
Little peek behind the curtain there.
That's insane. Good Lord.
So
Um,
it's not something I advise unless someone legitimately, they have a trach vent kit at home, or there's someone in the household that is oxygen dependent. Then it's like, just having a letter of medical necessity from your physician's office may not be the world's worst idea, even if you never have had a situation where you would even consider not being able to pay your electric bill.
Yeah, I mean, I don't expect our audience to like be the kind of people that would game the system in this regard. Most of the audience here, I think, probably returns the shopping cart to the little area.
That simple litmus test.
Or corral.
It works
Are you
every
a
time.
citizen or not? All right.
But anyway,
So thank you for that.
Going back to vaccines and antigens, even when there's the 2-month shots where they're getting hepatitis B and a pentacell, which is HIB, Haemophilus influenza B, and then a DTaP and a polio vaccine all in one shot, and then they're getting a pneumococcal vaccine, and they're getting a rotavirus. Like, no, their bodies really can't handle all that. I don't care if they're 8 weeks old. That is the highest antigen load they're going to be exposed to unless they start getting something really esoteric later on, like yellow fever or whatever. But it's like they really can't handle it. There is no reason, even in an immunocompromised child, to spread out that vaccine load.
So usually, vaccine getting spread out is more of a child. Yeah, it's like the child not being okay. Gotcha. Child not being so fussy.
And there's also no reason to not give vaccines because of illness. like there's no indication to delay.
Okay.
Like this goes for kids and adults. Like it doesn't matter if you have a sniffle or a fever or you were just on Tamiflu or whatever. Just go ahead and give it. It's fine. It's going to have the same result.
Are there exceptions? I mean, obviously, I guess if you had somebody, trying to think of an example here, if you had somebody that was critically ill,
If they are critically ill, they're on pressors, they're
Right.
ventilated, whatever. Like, okay, yeah, that is a reason to delay it.
right?
But if you're your bog standard, they can walk into the office.
Like an
they can
urgent
get
care,
it.
urgent care level
Yes.
illness. Yeah. Okay.
Yeah, urgent care that does not result in a transfer to the ED.
Gotcha. They're not unstable.
Yeah.
Like they're stable.
Yeah.
Okay. All right. All right. Cool. They talk about, let's see, stabilizing. Yeah, I feel like the first half, page 74 is don't use dirty needles.
I mean, yeah.
That could be summarized.
I
Mm,
can make it longer.
yeah.
Hmm.
And don't give hormone injections to no.
Yeah.
No.
What?
This is-
goodness, I didn't read this one.
For example, pregnant women are often given injections to speed up childbirth and give strength, but these injections are dangerous for the mother and cause brain damage or death of the baby.
I want to know where they get brain damage from because either Cytotec or PIT do not know. There's nothing.
I don't think that's hormone injections. I'm not sure where they're coming from.
They're
Hormone
going
injections.
Pitocin.
That's not
It's oxytocin. It's a hormone.
okay. Okay.
It's Pitocin.
I think of like growth hormone or something.
Yeah.
There might be another thing like culturally that we're missing out on compared to like austere things that where they just like give random meds.
I think they
Yeah.
did talk
Find it
about
in another
that.
chapter.
Yeah, they did talk about the Pitocin and yeah, we talked
Yeah.
about that previously.
Um,
Yeah, okay. Okay.
and then yeah, this next thing is just on cleaning and sterilizing equipment. And the thing that I highlighted in that first paragraph is anytime the skin is cut or pierced, it should only be done or should be done only with equipment that has been sterilized. Absolutely. 100%. Your skin is your body's like first part of your immune system in protecting you from all sorts of nasty things. Anytime we break that barrier, you need to be using a sterile instrument. And that's why like reusing needles is a bad idea unless you go through and sterilize them, whether that be with some of the chemical agents or simply putting it in a pressure cooker and steaming it.
Least of bad options.
I like this adding 1 or 2 grains of rice to the water for boiling. When the
Mhm.
rice is cooked, the equipment will be sterile.
Yeah.
I like it if you don't know exactly like what 30 minutes is gonna be. Again, we're assuming below 3,000 feet.
Yeah.
Pressure cooker if you're above 3,000 feet. And I know there's a whole discussion about like I think it's like 5 times going through a pressure cooker. I don't remember exactly. There was a whole
Your cycle up, cycle down. I got at least 3 as I recall. There might be more.
yeah, there was that army dentist attached to SF that did an experiment with a propane stove and a pressure cooker when he was out RVing, and I want to say it was 5. I want to say it was 5 that he did.
I would
like-
not.
Or what?
There's a video. I believe it's over at Soma as far as their website. They have an educational series.
Mhm.
And it's a little 20-minute talk by this army dentist who was like doing a lecture to SF on like sterilizing dental equipment.
Mhm.
And he did he did basically an experiment where he was just like out with his RV, so he's got like a propane stove and a basic pressure cooker and a little indicator bacteria that they're thermophilic, so
Mhm.
they do fine with heat. And so what he did was the question was like, if you can kill them off, then you can kill off whatever you need to.
Mhm.
And so he had like a pressure cooker that would tolerate up to 15 psi.
Yeah.
Of them. And I think you would do 20 minutes.
Mhm.
20 minutes at a time, and I want to say he did a total of 5 cycles for that.
Mhm.
But I'm not sure on the total number of cycles, but it was more than 1. And that's what he was talking about for sterilizing like dental equipment, because so much dental equipment is not reusable.
Yeah. Yeah, autoclaves will do that. They don't just like start it at ambient and then just jump up. Like there's like a preload and then it'll pull a vacuum to purge. And then it'll push again. That steam and pressure to process. And it's generally a for us, our stuff was a 60-minute cycle for manufacturing.
I remember we had an autoclave at the university when I was working in the micro lab. I didn't pay that much attention to how it worked. I should have more attention. I was more.
Well, we'd have to review cycle run reports to make sure that the cycle worked properly, and that was one of the things, like showing where like it did the preload and then it pulls a vacuum and then pushes the steam again for the full cycle time.
Yeah, we had just like somebody there that like that was their job was running all that equipment, and so
yeah,
I wasn't done yet.
Yeah,
it's just that annoying.
Yeah. You can pick up used autoclaves on I've seen them a couple of times on Craigslist, but you also see them on government auction sites routinely. Another place to check is nail salons. They have autoclaves. So like if one closes or something, they might be trying to offload their stuff.
The manual will be in Vietnamese, but
yeah. So
so we've got our last little direction on there. Or soak for 20 minutes in a solution of 1 part chlorine bleach to 7 parts water, or in a solution of 70% ethanol alcohol. And then try to prepare those fresh if possible. And then as we've been talking about squirting in and out with it. And you know, it kind of goes back to your whole thing about making your own bleach with the little electronic doodads, which I've forgotten the actual name of.
Yeah.
I don't think that's on the box behind you, but I'm not sure.
Actually, this one, yeah.
Yeah, it's like I should
disinfectant generator.
It's really difficult to tell how big that box was. The scale was just way off. I was like, yeah. All right, disinfectant generator, yeah.
Yeah, it's just an electrolysis.
A little salt in there. And
it's just got 2 plates, a cathode and an anode, and it runs electricity through that in the solution, and it interacts and creates chlorine gas, and which is why you want to do it outside. I may or may not have learned that one the hard way. So don't repeat my mistakes. I was like, well ventilated, and I was like, fuck, I got HVAC. This is well ventilated. My office is not well ventilated enough for producing bleach.
I thought I'd go for the whole World War I experience.
Yeah, I was just trying to LARP. You know, I had my doughboy outfit and my 1903. I wanted the full experience.
I look forward next time at the Jeep camp to putting the World War I helmet back on. That's got a certain feel to it. It's good.
Oh, so interesting chapter. Man, that was very interesting on that one. Any other comments before we close off on here? This one's going to be another lengthy one. But a lot of really good discussion was brought up. A lot of I don't want to say sidebars because they weren't sidebars, but important discussion and understanding and explaining like the how and why. Like there are certain risks involved with like piercing the skin, and like why you need to be concerned about those things. So I think those are important to bring up.
So again, I'll just telling everybody who's listening to the podcast, we talked for like 45 minutes before we started recording. We had a lot of fun doing it. And so like if you want to get in on that, it's like, hey, I'm a paying subscriber here, so I'm not making any money off of when I say this. You're kind of missing out if you're not on Patreon and you're not able, and of course if you can make it at the appointed time. But yeah, chapter 10 is looking really good. It's going to be first aid, which I think a lot of people are going to find very applicable. I think it's going to be very helpful. Looks like a pretty long chapter, honestly, which is fair. Broadly applicable chapter. Starts 74, I'm still looking for the end. Yeah, this thing, I don't know if we're gonna need to subdivide this one or not, because it goes on for a while.
Oh my lord.
It goes on a while, snake bite. Okay. All right. So yeah, so this goes from 74 to 106, so that's like 32 pages.
Yeah, we're gonna cut that in half.
I think we're gonna have to. So like 16 pages then.
Yeah.
So go to page 90. Where's page 90 take us? Bullet knife for serious wounds. So
that seems like a good place to.
That's a good that's a good break point.
Yeah, we'll let, since that's
gonna be right in your wheelhouse.
Yeah, since that's starting, page 90 is starting a new discussion. We'll cut it off. The last thing we'll talk about is 89. And then we'll let 90 to whatever the other page, what is that, 106? That'll be the next the other episode. So first half first aid will be the next one.
That's those two episodes should be really good, because I think that's honestly what most people are really going to get the most out of and they're interested in.
The first, between the first aid and like the history things, I think are the parts that are the most important to our discussion. I think is the most important.
Yeah,
and those are gonna be the things that you see the most, is like the general like sniffles and sick call things, and then like the first aid type injuries that you're going to see showing up to your little clinic. Those are going to be the things, the most common issues that you see.
Yeah, I mean, I don't know exactly what to expect out of chapter 11, which is nutrition.
Oh Lord.
I mean, other than land reform, but I expect it'll be pretty decent. There's probably going to be some stuff that's very specific to the mountains of Mexico.
Yeah, absolutely.
But I expect decent, I'm not going to go crazy, but they don't seem to be way off on their nutrition advice up to this point. Some of the stuff's kind of a little odd as far as the diet. I'm not sure what that's about.
Yeah.
All right, so that should be next three should be pretty meat and potatoes, like pretty useful. Honestly, I need to subdivide chapter 11 because it's like 24 pages of its own. So we'll see.
We'll probably cut that in half.
All right, so we got some good material laid out ahead of us.
Yep. It was a good time. Definitely the pre and post is always a good time. A lot of fun discussions had there. And it's just kind of like a catch up. Just everybody bullshitting, having a good time. So go on to the Patreon for that. Got classes on the schedule. Please sign up for one. It's basically this for 2 days in a row or 3 days in a row, depending on which class. It's a pretty good time. So with that, you guys don't have anything. I don't have anything. And catch you guys next time. Thank you for listening to this episode of the Stuck Pig Academy of Medicine. If you would like to join the Patreon, the link is in the show notes. Also, check out my training calendar for in-person classes. We'd love to have you.
It's a damn shame what the world's gotten to for people like me, people like you. Wish I could just wake up and it not be true, but it is. Oh, it is. Living in the world with an whole soul. Rich men north of Richmond, Lord knows they all just wanna have total control. Wanna know what you